Well, hi, everybody. I just first wanted to thank you all for joining the Benefits of Active Compression for Wound Management webinar today. My name is Jessica Duryea, and I am the Director of Sales here at NetHealth. Also from my team, you'll see that we have Kelly Beeson on the line as well, and you'll be hearing from him a little bit later. He's the Customer Success Manager for Connections. For those of you who are not familiar with NetHealth, we provide a specialty EMR for wound centers called NetHealth Wound Care. We are the leading industry wound care EMR with more than 55% of the overall market utilizing our software or a version of it. And today we decided to partner with Lympha Press to provide some educational insights into pneumatic compression. So without further ado, I am going to turn it over to Eric to introduce himself and tell you guys a little bit about what we're going to cover today.
Fantastic. Thank you, Jessica. I appreciate that. So my name is Eric Ansart. I'm the president of Lympha Press. Lympha Press is an in-home management system for the treatment of chronic edema and for chronic wounds. And today we're going to hear from Dr. Randall Russell, who I'll introduce here in a moment. Before I do that, I just wanted to mention briefly that last year there was a comprehensive study done in Dayton, Ohio by a large cancer facility. And they actually looked at 480 patients. In that 480 patient grouping, they found that the leading cause of lymphedema among that patient population was phlebolymphodema, which is the combined condition of venous insufficiency and lymphatic involvement or lymphatic obstruction. So with that understanding, I think our goal today is really to provide some education in how we can better utilize pneumatic compression for the treatment of chronic wounds and how dealing with edema will help with wound management. And then with that, let me introduce Dr. Randall Russell. So Dr. Russell and I met about 15 years ago. He's actually in clinic outside of Philadelphia, Pennsylvania, in one of the leading wound care centers in the metro area. And he has been in the wound care space after coming out of a time in general surgery. He actually transitioned into wound care and has been in that space for about 15 years. So he runs the lymphedema and wound care facility at the Lankenau Hospital, which is in the suburbs of Philadelphia. He's been a tremendous resource over the years for physicians around the country about treating and managing chronic edema and wounds. And for me personally, he's been an inspiration in helping me to understand the condition as we've evolved over the last 10 years. So with that, let me welcome Dr. Randall Russell.
Thank you, Eric. This is Dr. Randall Russell at the Lankenau Medical Center. And today I'm going to be speaking about the use of intermittent pneumatic compression therapy in the outpatient wound care setting. In this brief presentation, I will describe what intermittent pneumatic compression therapy is, how it improves vascular physiology, conditions for which it is suited, recognized indications, and how to obtain the therapy. Intermittent pneumatic compression therapy is a modality primarily utilized at home or in a lymphedema therapy center. When local coverage determinations are adhered to, intermittent pneumatic compression is generally covered by Medicare and most commercial payers. The system consists of a computerized controller whose settings are determined by the patient's needs, and a sleeve or garment that consists of numerous cells or chambers. Together, these components provide cyclical gradient intermittent pneumatic compression that helps to offload or decompress lymphatic channels and the venous system. Venolymphatic disease leads to venous hypertension, the accumulation of proteinaceous materials within the interstitium, stasis dermatitis, and often skin ulceration. Excessive edema and venous hypertension impair the immune system's ability to fight bacteria that have managed to invade the epithelium and dermis, leading to cellulitis. The use of intermittent pneumatic compression has been demonstrated to reduce edema, assisting clearing proteinaceous material from the interstitium and enhancing oxygen delivery to the tissue. Wound healing and the ability to prevent cellulitis is enhanced by increased oxygen levels. I have found in my clinical practice that the reduction and control of edema is paramount in reducing the incidence of cellulitis. One of the key goals in treating a patient with lymphedema or chronic venous insufficiency is to reduce the incidence of cellulitis that is not responsive to outpatient antibiotic therapy and then necessitates a hospitalization for IV antibiotics. The conscientious use of an intermittent pneumatic compression system, such as Lympha Press, will give the patient the best chance of staying out of the hospital and minimizing the incidence of significant complications. Clinical studies have demonstrated more rapid wound healing with the application of multi-layer compression wraps and concomitant intermittent pneumatic compression. Quicker healing leads to less healthcare dollars spent on wound care, fewer infections, diminished need for antibiotics, and reduced chance for hospitalization. Consistent use of intermittent pneumatic compression has been shown to reduce leg girth and volume over time. In the presence of a wound, less edema generally leads to less exudative drainage, less odor, and a shorter healing time. As the extremity is decongested through the use of intermittent pneumatic compression, patients commonly experience less pain and quicker return to baseline function. The IC Green study shows that Lympha Press stimulates lymphatic uptake, increases the frequency and speed of lymphatic function, moves lymphatic fluid in a distal to proximal direction using the lymphatic channels and vessels. This increase has been shown to last for up to an hour after pump use is completed. And finally, it shows that Lympha Press also clears proteins as well. Edema management is one of the core principles in wound care. Just simply requesting the patient to elevate their lower extremities and to wear compression stockings is not enough in attempting to decongest the extremity. The added application of an intermittent pneumatic compression device will augment oftentimes poorly followed conservative measures. Achieving a rapid reduction in edema will lead to improved oxygen delivery and enhanced wound healing. The wound bed is a very active and complicated environment. Inflammation is a necessary event in wound healing, but sometimes poorly controlled and regulated by a wound in disrepair. Improving blood flow and oxygen delivery at the cellular level can return a chronic wound to an acute wound and to a more normal and efficient wound repair. The goals in treating venolymphatic disease are to reduce swelling, limit inflammation, prevent skin ulceration, minimize infection, optimize function, and reduce the need for hospitalization. Intermittent pneumatic compression is generally used in treating lymphedema with or without ulceration, and in the setting of chronic venous insufficiency with ulceration that has not healed despite the use of compression stockings or wraps. In the therapeutic setting, the intermittent pneumatic compression system is generally applied multiple times daily. Once the goals of therapy have been reached, the intermittent pneumatic compression system can be utilized to maintain the patient's improved condition. Not everyone is a candidate for intermittent pneumatic compression. The standard of care conservative measures must have been tried initially. There are several contraindications for the use of intermittent pneumatic compression, including uncontrolled congestive heart failure, recent deep vein thrombosis, or a malignant condition in the extremity. For a patient with lymphedema to qualify for intermittent pneumatic compression, it must be demonstrated in the medical record that the previously outlined conservative measures have been adhered to for 28 days without significant improvement in the patient's condition. The medical record should indicate patient's symptoms, the presence of edema, the patient's adherence to a conservative treatment regimen, and the absence of improvement in the patient's condition. With appropriate documentation, one can minimize the delay in prescribing, authorizing, and initiating intermittent pneumatic compression should it be required.
Great. Thank you, Dr. Russell. Now that we have an understanding of when it's appropriate to use intermittent pneumatic compression and how a patient qualifies based on the documentation treatment course, we're going to talk a little bit about how to order seamlessly. For those of you who utilize NetHealth Wound Care, formerly known as Wound Expert, you may or may not be aware that you have the ability to submit an electronic order through our Connections module. Because all of your documentation is already being captured within NetHealth Wound Care, it's much easier to submit an order form rather than having to pull out a piece of paper and fill it manually. It's going to electronically pre-populate with all the documentation you've already completed. In this case, for your pneumatic compression form, and it's going to allow you to submit the form directly over to the vendor of your choice, or Lympha Press in this case. So now I'm going to turn it over to Kelly Beeson to provide you a brief demo for how to order within NetHealth Wound Care. Kelly?
Thank you, Jessica. I have a test facility here with test patient data, and I've gone ahead and started a visit for this patient. I went ahead and filled out some of the information, and now I'm ready to place my order. To do that, I'm going to click on the Visit Actions drop-down at the top right and select Connections. This will take us to the Connections module. Once that opens, I can scroll down to the pneumatic compression section, click on the drop-down, and select my vendor from the list. Click the green plus next to that to go ahead and open the form. You'll notice the form opens on a new tab. You'll also see that the information from the patient visit has already come over into the form and pre-populated the patient information, insurance information, home health primary care physician, and facility and physician information on the first tab. There's nothing left to do here, so because they'll all come over automatically. So I'm going to move on to the product order tab. Here I can select which object I'd like to order. You'll notice the options do change below depending on the item selected. Once I've filled in all the information that I need to, I do have an option to include some specific requests down at the bottom in a provided line. And I am done with the product ordering section. Now I'm moving on to the medical necessity section. You'll see that the diagnoses codes from the problem list on the patient visit have already come over. I have a few recommended questions down at the bottom to answer that will aid in authorizing or getting the equipment faster. Once the recommended questions have been answered and the form is completed, I'm ready to submit the form. I can include any additional notes in the provided field at the bottom. I can electronically sign the form by entering my username and password at the bottom, and then I can submit by clicking on the submit button. You'll notice that when I click submit, an additional pop-up comes up, allowing me to select the additional supporting documentation I would like to include in sending the order. Once I have selected all the appropriate documentation, I click submit again and the order is submitted. That concludes our brief demonstration. Back to you, Jessica.
Thanks, Kelly. So now we're going to go ahead and open it up for a little Q&A, whether you have specific questions on intermittent pneumatic compression, or whether you have questions on documentation or even how to order within NetHealth Wound Care. Please feel free to drop your questions in the chat below, and we can help address all of those needs. Thanks so much, guys.
Excellent. Well, thank you, Jessica, Kelly, Dr. Russell. As we mentioned, there is a Q&A tab on your screen. We'd be more than happy to go ahead and answer some of those questions as they come up for everybody. And it looks like we have a couple of them already. Jessica, it looks like the first one might be targeted to you. It's asking, can any clinic using NetHealth order Lympha Press this way?
Yeah, absolutely. So, one of the biggest benefits of utilizing the NetHealth Wound Care software because you're already capturing all your documentation from, initial assessment all the way to discharge, is that everything's already in the system. So whenever you need to order a product, going to that connections tab is going to allow you to select, the vendor that you want to choose from, for in this case being Lympha Press, but then also select the product, and then all the documentation is already going to carry forward onto the form. So it alleviates the need to fill out anything on paper anymore, which is a huge blessing all around for not only yourself on efficiencies and saving time, but also to make sure that we're capturing all the necessary documentation to be able to submit and send across for whoever is fulfilling that order. It's less back and forth than easier process for approval, and ultimately a quicker turnaround time for the patient to get the product that's necessary.
Yeah, and I will tell you, just from anecdotally from talking to clinicians around the country, people love utilizing EMR and Net Health system for ordering, because it does, as Kelly mentioned in the tutorial, it pulls all of the patient information and demographic information into the order. So you're not having to specify that. It also pulls the last 6 months of notes from the patient's records, which help qualify the patient so that we can expedite the order quickly and get the patient the device that they're looking for. So I would completely agree, Jessica. I think there's a lot of benefits all around to utilize EMR for ordering. See, there's another question here. It says, are there contraindications when we should not place a pump on the patient? And first off, let me apologize. Dr. Russell was in clinic and not able to join us for the post session, but I can definitely answer that question. There are contraindications. He mentioned them briefly, didn't get into them in detail, but the two primary contraindications are an active deep vein thrombosis. So if a patient has a deep vein thrombosis that has not been treated and is still active, then you would want to postpone use of the device until the patient has been cleared. The second thing would be if there is an active infection. So if you have a patient who has cellulitis or any type of bacterial viral infection that we'd be concerned about, possibly moving throughout or becoming more systemic, then we wouldn't want to use the device at that time. Typical protocol suggests 72 hours of the patient being on an antibiotic before you begin using the pump, if that is indicated. So, and most of the other contraindications are more related to significant ischemia. So if you have a patient who is a 0.3, 0.4, 0.5 ABI, very ischemic condition, then we'd want to avoid using the device. Most clinicians will tell you that if you have a patient who's in that more borderline category of ischemic / edema, when we have a lot of patients who we treat who are in that mixed condition stage, then what we're going to look to do is primarily treat the edema and see if the ABIs and the ischemic condition maybe improve after the edema. It's just like anything. If we can remove the congestion, then a lot of times the flow to that area will improve. So that's one of the attempts that we'll do. But for contraindications, primarily you're going to be looking for DVT, ischemic conditions, or active infection or cellulitis. You see, there's another question from Michael here asking about the average duration of the product. So Medicare and most insurance companies do cover this product for use in the patient's home. And in most instances, because this is a chronic condition, they will purchase this device for the patient's ongoing use. There's two sides to this. There is the upfront, more acute management, where we're using this device very actively, maybe 2 to 3 times a day to help improve the wound healing, to deal with that chronic edema management. But then there's also the ongoing maintenance phase of after the wound is healed, after the significant edema has been managed, we want this patient to be able to continue to use the device so that they don't re-ulcerate or they don't have a significant return of that edema. So most insurance companies and Medicare will actually purchase this product for the patient. Some insurance companies do rent, but even the ones that do typically rent to own. So that's typically the approach of most insurance companies. You see, Mary Jo is asking if this product is available in upstate New York. And I guess the answer to that would be more dependent on where you are. It certainly is available in upstate New York, but right now, today, we're really just talking about the availability of this product for clinics that are using the Net Health wound care system. I will tell you that if you have a facility that is using Net Health, just because you don't see the connection module or Lympha Press in the pneumatic compression section in the compression module, or in the connections module, I should say, it doesn't mean it's not available. What we would suggest is that you reach out to your facilitator and have them contact Net Health, because a lot of times it's just a matter of having it turned on. And that's a simple request. We've worked with Jessica and Kelly many times in that situation. They've been very helpful to easily make that change for us. You see, next question, what kind of documentation is needed to get approval? Size of the leg, question mark. So documentation is actually a very simple conversation because it's very clear with our product. What we're looking at are basically bookend notes, meaning we have a note to begin care, and then we have a note that is at least 28 days later that shows we've attempted exercise, we've attempted elevation, and we've attempted compression through that 28-day period. So if you have a patient with secondary lymphedema or phlebolymphatic lymphedema, I89.0 would be your diagnosis code. If a patient has that condition, then they can receive a pneumatic compression device after 28 days of conservative care. At the end of that conservative treatment period, so the book notes of the 28 days, you're just going to want to note that the patient's condition is still persisting or there hasn't been significant improvement. And at that point, the patient will qualify for a pneumatic compression device. So the documentation is pretty clear. The Net Health system certainly makes it easy to document, and most of it pre-populates for you. How early in patient care is it recommend to begin the ordering process? Boy, that's a great question. And I would tell you what we usually recommend is that you order the product when you see the need. So it may be too early we don't have the conservative care to qualify the patient for insurance or Medicare coverage. However, if you notice that the patient needs the device, we usually suggest that you place the order at that point, and then we'll be in communication with you to let you know if there are any additional documents or notes necessary to qualify the patient. Additionally, with Net Health, as you continue to see that patient over subsequent visits, all of those notes are populated into the patient's record, and you can hit a follow-up transmission of the order. And when we get that follow-up, it will include the signature, the signed notes from the clinician, as well as all those follow-up visits. So it makes this process very simple. If you don't have the Net Health system, it's certainly something to look into. You can do this process, through paper or fax machine if that's preferable, but it's certainly a preferred method to go that route. How does the patient get the pump after ordering? So Kevin's asking that question, and so it's a really important one. So with Lympha Press specifically, we go into the patient's home or provide a remote delivery and setup for every patient. So every patient is contacted from our office. We educate the patient on the use of the device and actually go through a trial period with them to make sure that they're comfortable using it, they can don and doff the equipment. One of the biggest pieces that we've heard over the years is a concern about compliance. Do patients adhere to the recommended treatment of this device? And we've done some of our own independent research to go out and have companies assess our patients. And what we've found is there's above 80% compliance with this device, reaching out as far as 2 years. So I think sometimes there tends to be almost a negative feedback loop where physicians may order this device, and then if the patient does well, they don't come back to the wound care center because they come back, they're discharged, and they tend to not re-ulcerate. But when patients are non-compliant, sometimes those patients end up returning to the wound care center and complaining or telling the physicians that they didn't use their product. And we're very aware of that, so we do what we can to provide upfront education to make sure we're helping the patient, and then following up with the patient over a period of time to make sure the patient stays compliant with the use of the device. Is there anything that needs to be done to the software to have access to this option to order the device? So Tony asked that question. It's a great question. Jessica, maybe I could defer that to you. Do they need to have something turned on?
So you should already have the connections module turned on within your software. But if for some reason you don't know where that is, or you just aren't seeing it turned on for whatever reason, then feel free to contact us. You can send an email directly to NetHealth, to myself, or to Kelly. Or you can submit a feedback as well, which if you're a NetHealth wound care user, you're familiar with the feedback button. It connects you directly to our support team, and we can then set up a call with you and give you a little bit more one-on-one direction on what to do. I know that demo looked a little fuzzy, at least on my end, so we're happy to kind of walk you through that a little bit more one-on-one if need be. But everybody should have access to the connections module.
That's great. And Jessica, there's a number of people that seem to be asking questions about contacting you and NetHealth about how to operate this module or how to subscribe to it. So I'm sure we can answer those people offline afterwards.
Yep.
It doesn't look like we have any other questions. Oh, we've got one from Doug, and maybe this will wrap it up for us. It says, can a wound care center who could not attend this meeting be able to watch on a tape link later? And the answer is yes. This will be sent to everybody after this meeting so that anybody who registered to this can watch this after the meeting. So with that, from Lympha Press, I'll let Jessica say thank you from her end, but from Lympha Press, we really genuinely appreciate your time and attention today. And we want to be a partner with you. We know chronic edema is a difficult condition to manage. And when you're talking about a wound, if we can manage the edema, many times success for the immediate acute wound and the long-term chronic wound is far improved. So that is our goal, to provide in-home treatment and management for you and for the patients.
Yeah, thank you guys so much for attending. And like I said, feel free to reach out to any one of us if you need some more assistance or just one-on-one interaction to kind of help walk you through the ordering process. We are happy to help. So thank you guys. Hope
Thanks,
you all
everybody.
have a wonderful day. Take care.
Bye.